Hello, I'm Dr. Kyle Cronin, and I am pleased to talk today about the use of anti-inflammatory diets in my practice of naturopathic medicine. I find it a very important topic, and so do my patients, because they often come in and they have been on this diet, and then they read about this diet. And then there's all of this information about how important anti-inflammatory diets are. But to me, what's really important is to make sure that you have your own individual health concerns. They are unique to you. And so you want to make sure that the diet that's anti-inflammatory is personalized and individualized for your concerns and for your metabolism. So when we're talking anti-inflammatory, I think one of the first things I remember is years ago I went to a cardiology seminar, all cardiologists, not naturopathic physicians, and they are, well, we really don't like this drug because it causes lots of inflammation. And, you know, one of them was a lot of the synthetic hormones for women. And this causes blood clots, and if you read in the fine lines, and I thought, oh my goodness, am I a naturopathic conference here? Because they're all talking about anti-inflammatory, it's the root of all disease. And if you go to endocrinologists, especially because of all the diabetes and sugar, causes huge amounts of inflammation, especially in the blood vessels and in the tissues. So that's, again, they will talk about anti-inflammatory diets. Oncologists for cancer often are talking about how things can start from your immune system being irritated by inflammation. So an anti-inflammatory diet is very important for all of us. And how do you know which one is going to be right for you? The things that I have found that work very well over the years, I usually run a food allergy testing. Really, it's a food sensitivity. I tell patients that there are two main ways that you can have inflammation from your food. One of them is going to be where your body, with the immune system, attacks the food with antibodies, as if it's fighting off a measles virus or a flu. And so you make all these antibodies, and of course, after you're attacking the food, you can feel kind of fluish or tired. That's why a lot of people are tired after they've eaten a meal, like after lunch. Oh, oof. So what you want is to identify that, and my favorite test is actually a blood test that just counts the antibodies, and so there's no guesswork. You just simply get the test back and it says, whoa, look at those antibodies over here. Oh, I had no idea. I eat that and I feel fine. But what we really want to understand is, even if you don't have symptoms, and of course many people do, but even if you don't have the symptoms, you don't want your body going into that inflammatory antibody mode. So it's a way to identify which are ones that are problematic for you. The other method that I look at, of course, is looking at the blood grouping. Yes, it is not a fad. There really is science behind it, in terms of there are, of course, 4 main blood groups. Each group is, well, there's O and A and B and AB. And each group is unique because it has a different little sugar on the blood group. So, example, sugars that you don't usually hear of. O is fucose, A is N-acetylgalactosamine, doesn't even sound like a sugar. B is D-galactose, and AB is the A and the B sugar. There are lectins in foods. These are proteins. It turns out, I think it was back in the 1940s, medical university got to name the word, a Greek phrase that basically means sticky. So I think of lectins as Velcro, sticky proteins. And it's these lectins that are in food that get to self-select which sugar they're going to stick to. And what happens when they stick to a blood group, or the sugar in the blood group, is it agglutinates, which is a similar clumping reaction, like if you were to give B blood, A blood, and it's a bad idea. So it's not as extreme as that, but it does cause this agglutinating reaction, and it can happen in the tissues, of course, first in the gut, but a lot of the tissues where the blood group type is expressed. And that can cause symptoms of colitis, bladder, migraines. There's all sorts of problems. And basically, you can get very detailed with many of these different lectin foods, but I find that there's about, actually identified by Dr. Peter D'Adamo, naturopathic physician, who he and his father before him studying a lot of this. researchers from all over the world have been studying all of this. And basically there are, some 4 or 5 top foods for each blood group that can be problematic. It's so much easier for people to go, oh, okay, so those 2 foods, oh, I don't really eat that. Oh, no, I don't eat that. Oh, I do like that. And so they have maybe 2 or 3 of their food sensitivities, 2 or 3 of the blood group. Maybe they're the same, those you really want to stay away from. And basically that feedback, when people stay away from those foods for a while, the immune system just calms down. It's not at war with everything. And that actually helps the liver, which I'm always working with, because the liver, of course, is clearing all the hormones. It's detoxifying all the chemicals and pollutants that are out there that act like hormones and everything else. They suppress our immune system, and they're just nasty. And then the liver also, it deals with our proteins, makes lymph. It deals with our fat metabolism, and it also maintains our blood sugar between meals. So the liver is a very, very busy organ. And if you start clumping the liver up, because you digest your food, if it goes down and it goes to the stomach, and you have all that acid that kind of breaks it into tiny pieces, although first you're supposed to chew your food and get it in really tiny pieces first. Goes to the stomach, tiny pieces, small intestine, kind of like sausage, You have all the enzymes that are breaking all of that apart. And then you're absorbing in your small intestine. It goes through the blood, and it goes right to the liver first. And the liver is, grand central station. It's got a triage. What do I want out of all this digestion? So when the liver is busy dealing with what it really needs, or also a few bacteria and viruses or anything else that might have come in with it, chemicals and whatnot, if it also has to deal with all of the agglutinating and all the clumping of antibody and the antibody reactions, and all of that goes to the liver as well. Eventually that just makes the liver not as efficient. And so basically you can have problems just from that. And when people go more for an anti-inflammatory diet, it's almost like a modified fasting. It really is, where people go, I'm on a liver cleanse, and that means you have a special diet and you're using a laxative or some such thing, is often how that is. But really, your liver is cleansing every day. It is working hard every day. And so you really want to be nice to your liver. We are just so not nice to our liver. And so we want to be nice to the liver, because then it can start working more effectively on all the things it was meant to do. And suddenly we feel better. One of the side effects of the liver is actually, you think, of course, like hangover, but you can also think of kids getting mono. What's the first thing? Oh, mono, I can hardly. That's liver. So if you have a liver that's not working very well, you can feel that kind of fatigue. You can have that morning nausea in the morning, a lot of liver symptoms. People don't want breakfast. Ooh, they don't want breakfast, no. It's because the liver's not ready yet for breakfast. I'm not ready for business. You gave me all that crap yesterday. How could I possibly do more today? So that's kind of how the liver works, is that when you start eating lighter, more of your anti-inflammatory diet, then you start feeling lighter. Your liver starts doing what it's supposed to. Your energy comes back. And it's a lovely process. The body really does want to heal us. It loves us. It really wants us to be happy. We have all these wonderful little receptors in the brain for happy neurotransmitters when they're balanced well. The gut has neurotransmitters, wants to be balanced well. The whole system needs to be so that happy in, happy out. And working with the liver is a huge piece of that. The anti-inflammatory diets, when you start doing that, suddenly people's eczema will start clearing up. Even things with thyroid symptoms can calm down some. There's so much that works more efficiently without all of that immune suppression. So anyway, I love anti-inflammatory diets. I love the liver, and I'm so happy to speak with you today. Thank you.